right. Good evening, guys. My name is Joe Durant. I'm one of the senior instructors for the Center for Pain and Stress Research. And tonight we're going to be doing a tutorial on the Dolphin Neurostim. So if you have one, please do get it out and have it handy. And we're going to start going over some of the features. So we're going to do about an hour of tutorial tonight, and we'll have about a 30-minute question and answer at the end. So if you have any questions, please hold them to the end. You can type them in the chat box and I'll answer them from there, or you can ask them in person once we get an opportunity at the end. So we're going to run for about an hour here and then do our questions and answers. So if you have a Dolphin Neurostim, you should either have a case like this, or if you have the vagus nerve stimulation kit, you'll have a box like this. Either way, if you will pull out one of the Dolphin Neurostims, we can take a look at it. Let me grab a pen here. So we're going to go over all the features of the unit. So starting at the tip here, we have a biocompatible alloy tip. If you push on it, you will notice that that tip retracts. So it is spring loaded so that it cannot pierce your skin. When you go about cleaning the tip, please use like an alcohol wipe. Don't pour any liquid in here because it can interfere with, there's a conductive medium in there that helps it conduct electricity, and you can cause corrosion there. So just take a standard wipe, alcohol wipe of any kind, and just clean the tip off gently right there. Moving up from there, you will see a little black button here. The black button doesn't do anything when the unit is off, but this is the button you would hold down to make the unit go into treatment mode. And from there, you'll notice there's a little roller switch right there. And if I turn this switch on, you can hear that the unit has a constant tone. And if I flip it over, you'll see a green light right here. So this green light indicates two things. It indicates, one, that the unit is on, and also that the battery is good. So I have a Dolphin Neurostim here that has a bad battery. So I'm going to turn it on, and you can hear the tone, but you don't see a green light right here. So if you turn the Dolphin Neurostim on and there's not a green light, that tells you that it's time to change the battery. So we're going to use the opportunity right now to teach you how to change the battery. If you look on the back, there is actually a battery compartment right here. You'll also notice there's a screw hole at either end of the Dolphin Neurostim. Please do not take this apart. We do have people who try to change the batteries by taking these screws out. If you take those screws out, the whole thing comes apart. You have to send it back to us to get fixed and avoid your warranty. So please just stick with the battery compartment. You'll either need a screwdriver. I like to use a coin. So just put a coin in that little battery compartment and pop it open. Let's see here. Well, let me get a screwdriver. That coin's a little too small. So once you get the compartment open, you'll see there's a standard 9-volt battery in there. There are 3 types of batteries that we recommend for use in the Dolphin Neurostim. So it comes stock with a Panasonic battery, and those look like this. You can also use standard Duracell batteries or Energizer batteries. Doesn't really matter which of the 3 you use, but those are the 3 we prefer. Oddly enough, not all 9-volt batteries are created the same. There are some 9-volt batteries that are a little bit shorter or a little bit longer. All other battery sizes are exactly standard: AA, AAA, C batteries, D batteries, but 9-volt batteries can be shorter or longer. And you'll notice that the compartment doesn't have any wires in here. So it's a specifically shaped for a certain size battery. So if you use one of those 3 batteries, you'll be in good shape. Also, don't try to use cheap dollar store batteries. They have a tendency to dump all their voltage at once, and that can actually damage the electronics in the unit. So once you take your battery out, get a fresh battery. Look at the diagram inside. It'll tell you how the battery goes in. Go ahead and insert your battery. And then when you go to put this door back on, this little battery compartment door, it's a really tight fit. So when you push this in here, it's going to feel like it's going to break, and it's going to give you a loud snap, but I promise you it won't break. It's just designed to have a really tight fit there. So at that point, we're going to turn the Dolphin Neurostim back on, and you can hear a constant tone here. And if you look, you'll see now that I have a green light, it tells me that the Dolphin Neurostim is all charged up. So if you're doing a treatment to yourself or someone else, and you happen to notice that the light goes off in the Dolphin Neurostim, you actually do have enough of a charge to be able to complete a treatment, but you need to change it shortly after that. Okay, so this is your on and off switch. This switch also allows you to change the intensity of the stimulation. So if you're doing a Dolphin Neurostim treatment and you find that it's too intense, you can roll this back a little bit or roll it forward to get more or less current through the tip of the unit. And moving up from there is a little tiny black button. So if I push that black button, you'll notice that the noise goes off. And if I turn the Dolphin Neurostim over, you'll see that there is a flashing light right there. So that flashing light indicates that the Dolphin Neurostim is in a constant treatment mode. So you don't have to hold any buttons down, and it'll run just like this for about 10 to 12 minutes. After that time, it will revert back to having a steady light and a constant tone. And at that point, you can either turn the unit off or you can push this button again and go back into a timed treatment mode. So that's a way to not have to fiddle with the buttons a lot when you're doing a treatment, if you're doing vagus nerve stimulation. Now, if you're not going to use this button, you're going to need to use this button. And so when you hold this button down, you'll notice that the unit flashes and beeps. And if I take my finger off the button, it stops. So as long as you're holding this button down, you are engaging a treatment. But as soon as you take your finger off this button, the treatment stops. So if you're trying to initiate a treatment, don't just push this once and think it's going to work. You have to hold this down constantly. And the other thing you have to do if you're going to hold this button down is you have to touch this metal plate on the back of the unit. So if you want to practice holding the Dolphin Neurostim, you want to hold it like a pen. So you want your thumb on this metal plate. You want it to rest right here between your forefinger and your thumb. And you want your middle finger to kind of hover over this black button right here so that I can just hold it down and release it whenever I need to. Now, if I hold that button down, but I'm not touching this metal plate, it's not going to deliver a treatment. So I have to have skin contact with this metal plate, or I have to have a special pad on it that I'll show you in a few minutes. But for right now, we're going to focus on how to do this manually. So you want to put your thumb here, and you want to put your middle finger over. So right now, the Dolphin Neurostim is in what we call search mode. And as long as it's in this mode, it'll allow us to find myofascial trigger points, acupuncture points, and motor points. So all myofascial trigger points, which are little tiny knots in muscles, about 80% of those are acupuncture points, and motor points, which are the most electrically active points in a muscle, are also all acupuncture points. So we're going to use this device to actually locate treatment points, and most of which are Chinese acupuncture points. So before we get into how to initiate a treatment, there are two more buttons we need to look at here. There are two slider switches right here. And you'll see one is marked skin type. And it says dry, normal, and wet. So the tip of this unit is designed to measure how conductive your skin is to electricity. And when it does that, it allows us to find the treatment points. But if you have really wet skin, that's salt water, which is very conductive to electricity. So we need to make the ohm meter, the point finder, a little less sensitive so it doesn't give you false positives all the time. However, if you live someplace that is drier, like somewhere out west, like I live on the coast of Georgia down in the States, and it's always damp here. So everybody always has normal to wet skin here. So I always keep this usually on the little normal setting. But sometimes if it's really hot outside and it's really humid, I'll slide it over to the wet setting. The other button you'll notice says polarity. So there's a plus, a minus, and a plus minus symbol on there. So by sliding this switch, you can actually choose the polarity of the output of the current on here. And that becomes important when you start doing protocols, because what you'll notice is that no matter which of our books, so we have, for example, we have one of our manuals is for vagus nerve stimulation. And if you look in there next to the points, there is a minus symbol right there. So when you see that symbol, and you can look on any of the pages, you just slide this over to the minus setting, and that's your setting for that protocol. Here's another book I have that we've put out. It's on equine therapy. So this is for treating horses. So let's pick a disorder of some kind in here. Let's see here. Sesamoiditis in the foot. You'll notice at each of the points here, there's either a negative or a positive. So you just follow that guide and you just set the Dolphin Neurostim on the corresponding polarity. And that allows you to treat that point on the proper polarity. So the negative polarity is going to bring things down, which is most of the things that you're treating. Those are conditions of excess. So that's things like headaches, muscles that are too tight, pneumonia, COVID, anxiety, trigger points in muscles, asthma attacks. Any of those things are conditions of excess. Those are things that need to be brought down. But occasionally there are things that need to come up. So an example of something that would need to come up would be if you had somebody with, let's say you were doing an acupuncture facelift, like a face protocol, and somebody had kind of a droopy face. You might actually treat acupuncture points along the face to tone those muscles a little bit to give it some lift. So that's one of the situations where you might use a positive setting. Or let's say you had someone who had they've had a stroke and their muscles are drooping somewhere. You might use a positive setting to bring things back up in that area. So that's just an example of how we might go about using those particular settings. If you don't know what to choose, if you're treating something that's not in one of our guidebooks, it's a general rule of thumb. Negative is going to be your best bet. You can't really get it wrong. So you can mostly only get these treatments more right. So using the positive setting when it probably should have been negative is going to be okay. It's just going to be not quite as effective. So there's a very wide safety margin there. So I wouldn't get too concerned if you happen to choose the wrong polarity. Oftentimes it'll work anyway. It's just you get a little bit better outcome when you are using the right polarity. Okay. So before we get into finding points, I do want to go over one of the accessories that comes in the Dolphin Neurostim pack. And if you look, there is an extension probe that looks like this. It looks like a ballpoint pen and has a little cup on the end of it. And if you look in that cup, you'll see there is a shiny little metal plate. So you can take that and slip it on the end of the Dolphin Neurostim. You want to make sure that the tip here touches the little metal plate in here. And that allows you to have an extension probe so that you can, this is bendable, so you can bend it any shape you want. So that allows you to use it to treat points in your back or your neck. You could tape this to a back scratcher to get to points if you needed to. You could use it to treat auricular ear acupuncture points. We used to use these some in women's health when I was working in women's health. We would make patients buy their own set if we were treating things like episiotomy scars. So that's a useful thing. Some of the people doing TMJ work will use these inside people's mouths to get to dental scars. So it's a useful thing. If you need extras of these, you can order them from the. You should be able to order them from the Dolphin Neurostim website. If you don't see them there, just call the company and they have them. I think they're about $30 a piece. They're not terribly expensive. All right, so moving on to using the Dolphin Neurostim to find points. So what I would like to do is to go over a couple of treatment points with you. And to do that, I'm going to grab let's kind of get you guys on the same page. If you happen to have the Vagal Up book, we're going to turn to page, let's find a good one here. If you turn to page 39, there's a protocol in there for anxiety. Okay. And you'll see there are 3 points on the wrist. So we're going to go over those 3 points, and I'm going to teach you how to locate them with your fingers, and then we're going to use the Dolphin Neurostim to verify the point location. So the first point, we need to locate a couple lines on the wrist. So if you look at your wrist, if you pull your wrist all the way back like this, you'll notice that there's a little line that goes across across the palm of your hand right here. But if you drop your wrist forward like this, so just let your wrist flop forward, you'll notice a lot more lines appear. So the line we're interested in right now is this farthest line out, which is the most distal wrist crease. So I'm going to mark that with a red marker so you can see it. This is about what it should look like. I don't expect you guys to mark this, but I just want you to see where I'm talking about. So we're going to use this line to locate what we call the treatment crease. So if I now drop my hand forward a little bit, you'll see there's another crease that's about the width of a ballpoint pen below that. So if I kind of drop this down and look, I'll see another little line there, and I'm going to mark that one in blue so you can see that. So the blue line is the line we're looking for right now. So we've got the red, which is our reference crease, and we have this blue line that we're going to call our treatment crease. So what we're looking for right now is 2 acupuncture points that are on this crease. They're not above the crease, they're not below the crease, they're directly on this crease. So we just need to work along here to properly locate them. So we're going to come over to the thumb side, and we're going to feel for the radial pulse. You can actually find your heartbeat right down here. And if you can find that, then you're going to move slightly to the side, because if you were using acupuncture needles, you wouldn't want to stick a needle through the radial artery. We don't like it when patients leak. That's generally bad for business. So you're going to move slightly to the side, and there's a little hollow right there. And one of the keys I can give you to finding acupuncture points is that acupuncture points tend to be in dips and hollows. So that's a little hint that you can remember when you go looking for these points. You're generally going to find them in dips and hollows. So a little hollow right next to the radial artery, I put a little X right here so you can see it. And then we're going to find one other point before we test them to see if we've properly located them. So I'm going to go to the other side of this crease, and I'm going to look between my pinky finger and my ring finger, and I'm going to come straight down. So I'm going to draw a line straight down for you. So let's see if I can do this in a way that works for you. You'll see there's I have a green line drawn that bisects this treatment crease. And if I feel right there, there's a little hollow right there that's next to the flexor carpi ulnaris tendon. So you'll see I've got now 2 little marks. Let's put another X right here. And those are acupuncture points, lung 9 on the thumb side and heart 7. So each of the acupuncture points is going to be on a meridian. A meridian is what's considered to be an energy line in acupuncture. They run up and down the body, front and back. The ones on the front and soft parts tend to be female or yin points. They're on the soft parts of the body. The ones that are on your back and your sides are on the hard parts of the body. Those are yang. Those are the male points. So these are on a soft part of the body because they're on the inside of the wrist. So the heart and the lungs are their organs that are responsible for nurturing you and keeping you alive. So those fall into the female category. So as a general rule of thumb, any of the organs that are nurturing and life-giving, and if you take them out right now, you're generally going to die, those are female organs. Those are yin organs. The male organs they tend to be things like your large intestines and small intestines and bladder. They're things that if you take them out, you can actually live okay without them. So one of the explanations I've seen in an acupuncture textbook was that while the female organs are life-giving and vital for life and nurturing, the male organs, like a man, are hollow, superficial, and they tend to fill up and empty. So there you go. So here's what we're going to do. We have our 2 points here, and these are both really good anxiety points. So your lungs in acupuncture are tied into the emotion of grief, and the heart meridian in acupuncture is tied into controlling your brain and anxiety. So these 2 points are good points for calming you down in anxiety. So I'm going to take a Dolphin Neurostim here. I need to get rid of this marker off my hand before I mark up everything in the room. Let's see here. Good thing I'm using a Crayola. Jeez. All right. So I'm going to turn the Dolphin Neurostim on. So I've got my thumb on this metal plate. I'm going to roll it on. I'm going to check and make sure I have a nice little green light here, which tells me that it is in good condition in terms of the battery. Now, if I'm doing this to myself, all I have to do is touch this metal plate. The connection is made once I touch this. And you'll notice that if I'm touching this metal plate and I touch this button, watch, the light goes out. See that? Yeah, if I take my thumb off of that metal plate, if I just touch there, nothing happens. But as soon as I touch the metal plate, you can see the light goes off. So that tells me I've got a connection. Okay. So in treating myself, I just need to touch this. But if I were going to treat someone else, this electricity has to come out of the tip and it's got to get back into the dolphin neurostim. So I actually have to have skin-to-skin contact with the person I'm treating. So if I were treating a point on their, let's say on their face, so I turn the dolphin neurostim on, I touch down on their face, I have to touch somewhere on their body to connect the circuit. And it doesn't have to be right here. So it could be somewhere else. I could stick my finger in their ear, put my hand on the back of their neck or whatever. But it doesn't work for me to touch their clothing. It's got to be skin to skin, okay? So when you're treating someone, you need to have skin-to-skin contact with them somewhere. It could be the same hand that has the dolphin neurostim in it. It could be the other hand. I've worked in situations where I had to have the patient just grab my opposite arm to establish a good connection. Any way you do it, you need to have some skin contact. So the hint I will give you for using this device, this is a very accurate point finder. A lot of time and development went into making sure that it will find acupuncture points just about every single time. But you need to go slowly. So if you move too quickly, it takes a millisecond for this device to register the acupuncture points. And if you move too slowly, if you move too quickly, sorry, you'll pass right over them and you won't even pick it up. So it's quite accurate. So I'm going to turn it on and I'm going to put it on the normal skin setting since I have relatively normal skin. And I'm going to put it on the positive setting because ostensibly I'm trying to calm something down. And I'm going to go over to the thumb side where lung 9 is, which is known as the vascular source point in acupuncture. So it exerts control over blood pressure. So we're going to pull this device along. I'm going to turn it this way so you can actually see. So I'm going to pull this along. And you can see that when I get on the point, the light goes out and there's a really high pitch. Now, if I take my finger off of this pad, the light comes back on. But here I'm on it. So I've properly located the acupuncture point. So I've pulled this around until the light went off and the tone went up. And now I'm going to push this button and the dolphin neurostim is going to flash and beep as I'm doing the treatment. If I take my finger off of this button, you'll notice that the beeping stops. So I have to hold this button down as long as I want to do a treatment. Okay, so that's one acupuncture point. Now we're going to go to the opposite side of this line. So we're going to come over to our heart point. This is heart 7. Heart 7 is known as Shin Men. It's like a body relaxer point. So we're going to take this and pull it across the skin gently. And I'm going to turn this up this way so you can see it. I prefer that when you hold this, you have your thumb on it. But for the purposes of demonstration, I'm going to put my finger on here. So I'm going to pull this across my skin. And then when I get over the point, the light goes out and the tone goes up. So if I take my finger off, the light goes back on. Here it's on. So it's a very accurate point finder. It does take a couple of days to acclimate to using it. So I recommend just looking in your book, whatever books you have that come with the device, finding some of the acupuncture points and locating them on yourselves. There are a couple of things I will tell you that can make it a little bit tricky. So here are the things you need to be aware of. If you push too hard with the dolphin neurostim on the skin, it will compress your skin and it will make it more conductive. So let me finish cleaning this ink off my finger and I'll demonstrate that for you. All right, that looks a little better. Let's see here. So I've got the dolphin neurostim on. This isn't an acupuncture point, but watch. So if I touch down there, not much happens. But if I push really hard, you'll see that the light goes off. Okay. So if I push really hard anywhere, it's going to make the light go off and the tone go up. So what you want to be careful of is you're not pushing too hard. So just set this down gently on the skin and pull it along gently, and you shouldn't have any trouble finding acupuncture points. You guys, and I forgot to mention this at the beginning, so you guys are going to get an email tomorrow that will allow you to review this video again. So if there are parts of it that don't make a whole lot of sense, like watch it again tomorrow. And you're also going to get an invitation to join our Facebook forum. So if you have Facebook, you can join that forum. Tons of therapists and tons of people who use this get on there all the time and they post questions or they post protocols that they've come up with. you may be treating something odd that isn't in one of the treatment protocol books, and you can ask how to treat, I don't know, how do you treat a burping frog? And somebody will tell you how they treated a burping frog. So it's a good place to ask questions and keep up with upcoming events. So if there's new equipment that comes up or there are workshops that come up, you'll know about them. Okay. So that's the basics for finding acupuncture points. And like I said, just look at the polarity next to the point, and that will tell you which polarity to choose on here. When you treat the points, so let's say I've got a headache, and it's just a tension headache at the front of my head, or a TMJ jaw headache. I want to use this point right here, large intestine 4, that's between my thumb and my index finger. So it's not in the web of it's not in the skin here. It's up in this meaty area. So I'm going to find large intestine 4. Let's do this so you can see it. So I've got large intestine 4 there. When I push that button down, you want to hold it for a count of about 30 beeps. So in our protocols, they're set up so you do about 30 beeps on each of the points. Now, you can go back and retreat those points again, but initially to start with about 30 beeps. You're really going to be surprised how quickly you will respond with some of these protocols. It doesn't take a lot to get the body to normalize, because what this does is it acts as a neuromodulator, and it actually modulates your nervous system some and helps level out problems that are tied into how your body perceives stress. So that being said, we're going to move on into the vagus neurostimulation portion of this. So if you have a vagus neurostimulation kit, it'll be a good time to pull it out. In your kit, you should have a Dolphin Neurostim. You should have a bag like this. The bag is going to have a number of things in it. It's going to have a white cable like this. It's going to have a couple of sets of ear clips like this. It is going to have, there's another set of ear clips. I have a white set and a black set in here. No significance there, just whatever you happen to get at the time. There is a black cable like this that may be in your box somewhere. There are some small oval electrodes like this. They look like this. And there are also some rectangular electrodes that look like this. So that's the bulk of your kit. And if you look, there's a little fold-out piece here. There's some information on the back of this that you might want to review at some point. It's a useful thing to have. Just tells you how to be a part of the community that we have. And there's also a quick setup guide in here for setting up vagus nerve stimulation. So that's useful as well. That's down in your unit somewhere. And there are also some alcohol wipes. Obviously, there's only a couple here, but we do recommend that you get some alcohol wipes if you're going to be doing vagus nerve stimulation, because it allows you to extend the life of the electrodes that come with it, so you don't have to buy more immediately. All right. So to set it all up, I have put one of these together so you can see what it looks like. So the black cable. Oh, there's also, I almost forgot to mention, there is a black cable in there that is shaped like a Y that looks like this. This is a brand new development in vagus nerve stimulation. So this is a new thing. If you bought your kit a while ago, you probably don't have these. These just came out last week. You can acquire these by going on to the Dolphin Neurostim website. So we're going to go over how to do vagus nerve stimulation, both with these and without them. Okay. So you're going to take the black cable and you're going to put it on the tip of the unit, and you're going to attach this Y cable to the black cable. And then you're going to take one of the set of ear clips and attach that as well. So it doesn't matter which side you use. You're going to put an ear clip on either earlobe like this. I do recommend that you moisten these. So either use like a little bit of alcohol or a little bit of salt water or something like that. And what it does is it disperses the current across here. Sometimes people kind of get hot spots where it irritates their ear a little bit. But if you put some, if you just put a little bit of water or alcohol in here, I like to use alcohol because it sterilizes it too. If you put that on there, it disperses the current fine and it shouldn't irritate your ear. So we're going to put these on my ears like this and like this. So we've got that set up. You're going to take one of these white oval electrodes. You're going to stick it right here. You're going to connect it to the white cable. And at the end of the white cable, you're going to take one of these rectangular electrodes. Pull one of these out. And before you put this on your skin, I recommend that you clean your skin with an alcohol wipe. So I'm going to grab one of these wipes right here. I'm going to clean my wrist off a little bit. You want to clean off your left wrist. That's primarily what you're going to do. So you're going to clean your left wrist off really well like this. Dry it. And connect up to one of these little white electrodes. And you're going to slap this on your left wrist. So right across this area here. And you'll have a good contact. Now, what we're actually shooting for here is to get these over, to get that pad over those 3 acupuncture points I was just talking about. So the anxiety points I showed you a couple of minutes ago, which again are on page, here we go, on page 31, I've got this pad over those 3 points. So you can put the pad across your wrist like this, or if you have a narrow wrist, you can put the pad like this. So you're going to hit this point, and there's one down here as well that you will also be hitting. So once you have that, you're going to turn the Dolphin Neurostim on, and you'll notice that the light should be off because you have a good connection. Okay, so if I didn't have a good connection, then, no, wrong one. If I didn't have a good connection, the light would be on like this. But once I have a good connection, the light's going to go off. Then I'm going to push this black button right here. And the Dolphin Neurostim will start to cycle. Now, we're going to put this on the biphasic setting. So if you look on your polarities, there's a minus, there's a plus, and there's a plus-minus setting. When you're doing vagus nerve stimulation with 2 ear clips on, we recommend putting it on the biphasic setting. So this is going to run, if I put it on the low setting, it's not going to blink a whole lot. But if I put it on the higher setting, it's going to blink most of the time. So this will run for anywhere from 10 to about 12 minutes. And the cycle will be over. So the first time you do a vagus nerve stimulation treatment, when we do this in our office here, we typically have our patients do it for about 5 minutes. We want to see how the patients respond. Most people don't feel a whole lot after 5 minutes, but occasionally you run into somebody who has a very sensitive system. So we just do 5 minutes. We let the patient sit for a few minutes and see how they're doing. And then we send the unit home with them for home use. If you're going to be using this for home use, we do recommend that you add about 5 minutes per day. So start with 5 minutes and then add 5 minutes a day up until about 30 minutes. There are indications where you might use this longer than 30 minutes, but for the most part, 30 minutes is good for most folks. Okay, so you can use 2 ear clips, but you could also do just 1 ear clip. So you could do this on your left ear and left wrist, and you could switch this over to the negative setting. You could put this on your right ear and put this on your right wrist. And you could use the positive setting. We don't recommend doing the right ear and using the positive setting by itself because it tends to bring your system up quite a bit. So this is not something you would want to do before bed. If it's before bedtime, you would want to use a negative setting and nothing else. So if you're going to use positive stimulation to try and bring your system back up, we do recommend doing that in the morning And don't do it in the evening, because we have people who get sleep disturbances from doing the positive polarity. The other place you can put this electrode, both with left and right ear stimulation, is below your belly button. So you'll just measure, you'll find your belly button, you'll go 4 fingers below your belly button, and you'll put this right there. And that's another area. The vagus nerve is called the wandering nerve. It starts right here on either side, runs down, kind of comes together right here, and then shoots down to your internal organs. It is the information superhighway between your brain and your gut. And more information actually goes from the vagus nerve to the brain than goes from the brain to the vagus nerve. So it is often referred to as the second brain, and it exerts a very strong influence over your autonomic nervous system. So the autonomic nervous system encompasses both your sympathetic and parasympathetic nervous systems. The sympathetic side of your nervous system is your fight or flight response, and that's the part of you that gets wound up when you get stressed. So when that happens, your cortisol level goes up, and a lot of things happen in your body to get you ready to fight or to run away. So it prepares you for a very stressful situation. The parasympathetic side of your nervous system is what kicks in for your body to relax. That's what they call rest and digest. So by stimulating the vagus nerve properly, you can modulate the balance between the sympathetic and parasympathetic nervous system. So why is that so important? Well, your body should spend about 70% of its day on the parasympathetic side of the nervous system. That's the rest or digest side. If it spends any less than 70% of its day there, you don't recover from things. So your immune system starts to suffer. You don't recover from workouts. If you're sick, you don't recover as quickly. If you've had surgery, you don't recover as quickly. So the more we can get that stress response under control, the better off you are. Now, you want a robust stress response, a robust fight or flight response when it's needed, but it needs to go away very quickly. And if it doesn't, what happens is your cortisol levels go really high, and it messes with numbers called your heart rate variability and your high frequency vagal tone, which are measures of how robust your body's ability is to deal with incoming stress, disease, injury, fighting, whatever, and also how well it's able to heal from that once it happens. So when would you use vagus nerve stimulation? Well, it's used a lot in professional athletics. So they use it after workouts, after really intense workouts. You can actually, if you're a really hardcore athlete, you can go into what's called overtraining syndrome, and your body gets so stressed out from training too much that you don't get faster and you don't get stronger. So you have to have about 72 hours of rest to reset that. But you can do vagus nerve stimulation immediately after a workout and skip that whole 72-hour rest period if you're in overtraining syndrome. That becomes really important for people like endurance athletes and marathon runners and people like that, because they have a tendency to overtrain themselves, and then when they're training for a specific marathon or race, they don't peak in time because they've had to rest too much and couldn't get in enough training. We use vagus nerve stimulation actually quite a bit for strokes and traumatic brain injuries. We also use it for people who have chronic inflammatory responses. So things like MS and like any kind of autoimmune type disorder, or things like toxic mold exposure, all those are conditions that result in very high levels of systemic inflammation in your system. So one of the things that vagus nerve stimulation does is it reduces systemic inflammation. Now, it can take a week or two to start bringing those numbers down some, but it can be a significant difference in how you feel. You can notice differences very quickly. And when you're dealing with something as acute as something like COVID or one of those types of things, doing vagus nerve stimulation every day is a very good recovery tool. I actually used it a lot when I had COVID. And the one day I didn't do vagus nerve stimulation, I almost had to go to the hospital. So I learned a lesson there. I woke up and did all my vagus nerve stimulation one day. My oxygen saturation was hanging around 91. This was back when the Delta variant was around, and it was pretty bad. So anyway, I felt like I was doing okay. So that evening, I didn't do vagus nerve stimulation before I went to bed. And I woke up the next morning, my oxygen saturation had dropped from 92 down to about 80. And that's really bad. That's bordering on having to go to the hospital. I used to be an EMT when I was in college, and those are numbers we didn't really like a whole lot. So I raised 2 children by myself, and I didn't want to have to go to the hospital by myself and leave my kids at home. So I got them to bring me my vagus nerve stimulator, and I set it up on myself. And after a couple hours of doing vagus nerve stimulation, I was able to get my oxygen saturation back up to a healthier level. And then I was subsequently able to recover from COVID. So anyway, it's a very, very useful tool. It's also used in people who are trying to deal with stress. So it's really good for bringing down anxiety. If you are a performer, it's not a bad thing to do for a few minutes before you have a performance, because it levels things out so that you're not stressed out by what's going on there. So there are a lot of indications for it. If you Google up HRV, which is heart rate variability, that's one of the measures that vagus nerve stimulation affects. And so if you do vagus nerve stimulation, one of the things you find is it will actually drop your cortisol by as much as 50%. It's very fast. It's a very, very quick response. So it very quickly deals with stressors within your system. So that's kind of the basics on vagus nerve stimulation. We teach entire courses on this. We do offer some online courses, and we do offer some in-person courses as well. So this is a little tutorial, and you guys are welcome to come back and revisit this. But if you're going to be doing this professionally, we do recommend that you pop over and take one of our either online, full or online courses, or one of our in-person courses. All right, so where are we on time here? We're about 8:15. So we need to go over how to treat a scar. And scars are actually one of my favorite things to treat with the Dolphin Neurostim. It is a really great tool. I have used it for years working in neurology and neurosurgery offices. I've used this system for, gosh, probably about 20 years now. I've worked in pain management clinics. I've worked with neurologists. I've done quite a bit in dealing with people with pain. And one of the things that I've always enjoyed doing is treating people who have painful scars or scars that limit their range of motion. And sometimes I've also worked with people who just have scars that are visibly not pleasing. So to teach you guys how to treat scars, I'm going to use a piece of paper, and we're going to pretend like I have an open heart surgery scar. So let me grab a pen here, and let's draw us an open heart surgery scar here. I'm actually just going to tape this to my shirt so you can watch me as I do the treatment and explain it. We're going to put this on kind of like a little bib here so you can see it. So here's my nice open heart surgery scar. So one of the first questions people ask is, how soon after surgery can you treat a scar? Well, you could treat it as soon as you get out of surgery, assuming you can get to it. Obviously, you don't want to treat in the incision itself. So you want to stay outside of the walls of the incision. But as soon as you start treating, there are several things that happen. So if it's a fresh injury, this will increase ATP production by 400 or 500%. ATP is an adenosine triphosphate. It's the mitochondrial fuel, so it really ramps up healing. It also increases cellular membrane transport and protein synthesis. So those are things that go hand in hand with healing things up quickly. And I have actually used this system on friends of mine who had diabetic ulcers on their feet that wouldn't heal. They've been to wound care at the hospital. It wasn't working. We're able to do this and get some tissue granulation so they didn't have their toes cut off, which is a nice thing. Okay, so we have our little open heart surgery scar here. And really what we want to do here is we want to bounce electrons back and forth through this scar. So the way you change a scar, and make no mistake, once you have a scar, you've got it. It's not going away. You're not going to break it up. It's not going to absorb into your system or anything like that. It is there. However, you can change the density of the scar. So we've done some ultrasound testing. We've got people who have really high-end ultrasound equipment. They measure the density of these scars for us before and after treatments. So what we know is if you do this properly, if you do this treatment properly with one treatment, you will get on average about a 20% reduction in the overall density of the scar. So what does that mean? Well, scars are electrically depolarized tissue. And if you can repolarize the tissue, then you can change the consistency of it. So if you can bounce electrons back and forth through this scar tissue, then you can change how it responds and how pliable it is. So the less dense a scar is, the more pliable it's going to be, the less it's going to impinge all the little nerves that are coming up to the surface of the skin, the less it's going to pull on other areas. So we've seen things like people with a shoulder problem. They can't move their shoulder, but they don't have a shoulder problem. What they've had is a hip replacement. And you treat the hip replacement scar and their shoulder moves fine. So it's almost like somebody was pulling from down below on their shirt. So you've got this connective tissue all through your body, this fascia. And this fascia limits your range of motion if it gets stuck down anywhere. So a big scar like this on your chest can cause an awful lot of neck and upper back pain. I've treated quite a few open heart surgery patients for neck and upper back pain. They're typically rolled, their shoulders are rolled in and they can't get their shoulders back. If you open this up and allow their shoulders to come back, it takes the pressure off the back. And I used to do some work in women's health. When I did that probably one day a week for, 14 years. We treated lots of C-section scars, lots of hysterectomy scars, and lots of post-mastectomy scars. The lower hysterectomy and C-section scars contribute significantly to low back pain and even neck pain. They tend to pull people forward a lot. So if you can open them up, then they tend to have a lot less discomfort. Okay. So if I were going to treat this scar, you need not one, but 2 Dolphin Neurostims. It's important to have 2 of these because you have to bounce electrons back and forth through this tissue. You couldn't use a normal TENS unit and just slap some pads on here because scars don't conduct electricity well at all. They're very non-conductive, okay? So if you're going to get this thing to release, you have to force electrons through it. And the problem is electricity takes the path of least resistance. So if I put a pad over it, the electricity is just going to go around the edges and just going to circulate around the area. It's not really going to cross the scar itself. But if I have 2 separate sources of electricity, okay, that each have their own power source, and I'm going to use a negative setting on one side, so I got negative there, and I'm going to use biphasic on the other, okay? Doesn't matter which is on which side. So I'm going to push electrons from one side of the scar to the other. I'm going to pick them up and throw them back across. So it's like a game of ping pong. So it kind of looks like this. So with the Dolphin Neurostims on, you're going to start on either side of the scar, like right here. And you can start at the bottom and work at the top, or work at the top, start at the bottom. So you're going to hold for about a 10 beep count. So you're going to count out 10 beeps. Then you're going to move down about 1/4 of an inch and count out 10 more. You're going to do that all the way down the scar on either side, going in 1/4 of an inch increments. So the longer the scar is, the longer it takes. When you get to the bottom of the scar, you're going to flip the units across from each other. So change hands. So you're changing the polarity from one side to the other. And you're going to work back up the scar. Same thing, 10 beeps each time. So what we're doing is we're kicking these electrons back and forth through this scar tissue here. It's like a game of ping pong. We're just bouncing electrons back and forth through there. And the more electrons you bounce back and forth through there, the better the outcome is. So in real life, it looks like this. I'm going to turn my Dolphin Neurostims on, make sure I got a green light here on each Neurostim. So I got a good battery. Got one on the negative setting, one on the biphasic setting. I have my thumbs on either plate. I have skin-to-skin contact. We're going to pretend like I don't have a shirt on. And we're going to go on either side of the scar. And I'm going to push the buttons down and hold for 10 beeps. Move down 1/4 of an inch, hold for 10 beeps. So I'm going to do that all the way down. I'm going to come back up. So that's a second sweep. And I'm going to go all the way back down again. So that's 3 sweeps. So that's 3 sweeps at 10 beeps each. So you're going to get 30 beeps per point. And then once you get done with that part of it, you're going to start at either end of the scar. So you're going to put one Dolphin Neurostim at the top, one at the bottom. And now you're going to go not outside of the scar, but actually on the scar itself. You're going to move to the middle, going in 1/4 of an inch increments. Then the units will pass each other. And you'll go so on and so forth to get the end. So I'm going to do that 3 times. I'm going to do 3 sweeps just like this. So what I'm doing now is I'm forcing electrons directly down through that scar tissue. And in doing so, I'm repolarizing it. And you will see almost immediate results with this scar tissue stuff. If somebody comes to me with a painful scar, my expectation is that on the first treatment, they should have at least a 50% reduction in the overall discomfort of the scar. It's very, very fast. And typically, if the scar is sunk in, it will start to pop out a little bit. And if the scar is if it's hypertrophic and kind of purple and raised up a little bit, it'll flatten out and the color will normalize to more of a pink. If it is like a keloid scar, sometimes you see really big keloid scars on people. You can't completely get rid of keloid scars, but I have seen them reduced by as much as 50 or 75% on one treatment. So they'll shrink way down. It's a fun therapy to do. It works almost every single time. So what if you had a scar that wasn't an open heart surgery scar? Suppose it was a circular scar. What if it looked like this? What if you had a big round scar like this? What do you do? Well, you're just going to go around the scar like a clock. Same thing. Count out 10 beeps all the way around 3 times, 3 passes, and then just work all through the scar itself. No big deal. So any scar you can treat, just stay out of open wounds and you should be in good shape. So I do market scar therapy. I market it to surgeons. I specifically will market to plastic surgeons. We do a lot of free treatments around here for some of the VA patients who aren't getting outcomes over at the VA. We have a nonprofit here at our office that called Heroes for Health that helps support care for veterans. And so they get some free scar treatments when their legs have been blown up and stuff like that. However, when people have been and paid for plastic surgery for their faces or their tummies or whatever they had plastic surgery on, if they have a painful scar from that, they paid money. They paid cash to have that done to them. So we charge them cash to make that pain go away. And they're glad for it. We charge $150 for the first visit, and follow-up visits are about $90 a piece. They take anywhere from 30 minutes to an hour. So it kind of depends on how extensive the scarring is. But it is rare to find a scar that does not respond to this. I would say I don't think I've ever seen a scar that didn't in some way or another respond to microcurrent treatment. It's almost a given it's going to respond. So very, very useful therapy for treating scars. So I suppose I should probably go over some of the contraindications for this treatment, when to use it, when not to use it. So one of the questions I get a lot is, can you use this on small children? Yes, you can. We've done workshops for All Children's Hospital down in Tampa. They were using this stuff on babies, like babies who had spasmodic torticollis in their necks. I use this on my children when they were babies, use it for colic and hiccups and all kinds of things like that. And it does work quite well. Just turn it down and don't hold it as long. Things you want to stay away from. My general rule of thumb is don't stick this anywhere you wouldn't stick a pencil. So keep it out of the ear canal, keep it out of your mouth. Don't stick it up your nose. Don't stick it in your eye. You should be good. Are there acupuncture points and places to avoid? Yes. If you have a history of seizures, don't treat directly on top of the head. You can treat anywhere else, but don't treat directly on top of the head. There are actually acupuncture points that are designed to stop seizures. There's one on the bottom of the foot called Kidney 1. I've used it a couple of times. It will stop a seizure, so it works quite well. If you are pregnant, I recommend getting the okay of the doctor, of your OBGYN first before you do this treatment. Microcurrent on acupuncture points has been used to induce labor. So it's not generally going to induce labor in somebody who's not ready to go into labor. If, however, you are pregnant and your doctor wants this to be used on you, or you want to use it, there are some points to avoid. Avoid large intestine 4, Hoku. This is the great eliminator point. You don't want to use a great eliminator point when you're trying to keep a baby in. Stay away from the tops of the shoulders. That pushes energy down. Stay away from the top of the head. That pushes energy down. Stay away from the insides of the ankles. Specifically, there are acupuncture points there that are used to induce labor. So if you avoid those, don't treat over a gravid uterus. So don't treat over somebody's tummy. Typically, OBGYNs are fine with you treating the back, treating the extremities. They're usually okay with that. But again, get their okay. If you have someone who has a pacemaker or defibrillator, get the doctor's okay first. That can be a contraindication. So check with their cardiologist and say, hey, we'd like to use the stimulator on your patient. There's a little guidebook that comes with the Dolphin Neurostim, and there's a page in there that looks like this. It's got all the electrical output information of this equipment. You can Xerox that off, send it to the doctor, and have them check yes or no. Other things, plates, screws, staples, pins, artificial joints, all of those are fine. There's no trouble whatsoever with those. Dorsal column spine stimulators are fine. Just have the patient turn them off. Baclofen pumps are fine too. All those pumps and stuff tend to be fine. That's not really an issue. If there's something that you think is questionable, I would just send a note to the patient's primary care doctor or whatever doctor is in charge of whatever device they may have that you are concerned about. But this is generally a very safe device to use around things. It's in the microamp range. So that's less than a milliamp. It's millionths of amps. So it's actually a teeny amount of electricity. When you scoot your feet across the carpet and touch the doorknob, that's way more current than you'll ever get with this. Okay. Very, very small amount of current. And the reason you have to use this on acupuncture points for the most part is that that's the most conductive points on the skin. So if I put this on a non-acupuncture point, I don't really feel a whole lot. But if I put this on top of an acupuncture point, the current gets past the skin down to the tissue underneath, and I feel it a whole lot more. So it can burn and feel kind of sharp. You're not going to get a burn, but it can feel kind of burning. All right, so let's see what else we need to cover. Let's see, we've gone over contraindications. I think that's probably just about everything. So what I would like to do, let's see, we're at about 8:30. So I would like to take a few minutes and look through the comments here and see if we have any questions from you guys and see if we can answer those. So let's see what we've got down in here. When in constant time treatment, so when you've turned the Dolphin Neurostim on and you've pushed this button, do you have to touch the grounding? If you have that electrode on here and the white wire goes to your skin, no. But if you are holding it with your hand, yes, you must touch, you must be in contact with this. How do you treat pneumonia? There's actually a whole pneumonia protocol in one of the books that comes with this. You end up treating a lot of lung points, but I'll give you a couple of points. If you go to the thumb, on this side of the thumb, there's a point right here called lung 9. It's at the corner of the nail bed. It is a jing, well, or ting point. That is used for acute respiratory distress. Any of these three calming points right here that are in your vagus nerve, your VNS book. So what you'll actually find out is that this book actually has the acupuncture points that you would want to use if you happen to have pneumonia. That's the best thing I could tell you. Like, this is where you would want to look, because this is for lung disorders. Why does it say minus V? They're just using that to indicate negative. Yes, okay, so positive can be used for toning. Yes, positive is used for bringing things up. Negative is used for bringing things down. So positive is to tonify. Negative is to sedate. The biphasic setting on here, you're typically going to use when you're doing either vagus nerve stimulation or when you're treating scars. So those are the two times I use it most. Occasionally when I get to the end of a treatment, so let's say I've done an entire back protocol on somebody, I get them up, they're moving around, they feel better. Sometimes what I'll say is, hey, are there any points left where you still feel the pain? Like, is there a specific point you can put your finger on? And if there is a point they can put their finger on after I've done a full back treatment, I'll switch the device to the biphasic setting and I'll put it on that point and hold it there and have them flex forward and backwards and move around a little bit. And a lot of times that will kind of finish out the protocol. Why positive settings? You said that negative settings bring things down. Well, sometimes you need to bring things up. Sometimes you have things like different types of like stroke disorders or where things are drooping. Or another example might be if you have somebody who has like really acute pneumonia, they got a lot of fluid in their lungs. You actually want to put energy in there to to help expel. You can put heat in there to help expel the fluid. Is a way that's looked at in acupuncture. Um, if somebody's adrenals are shot, um, that they're stressed out all the time, you want to tonify their kidney points. Your kidneys are your life essence. And if you tonify the kidneys to bring your kidney energy up, that replenishes your adrenals. Let's see what else we got here. Positive setting for heart 7 because you're trying to calm something down. Yes, I meant to say negative. My apologies. What points would you use for carpal tunnel syndrome? Carpal tunnel syndrome is one of those things that people have a tendency to do an awful lot of treatment right on the wrist. I can tell you that after using the system for about 20 years, I treat the low back first because the hips affect everything. If your hips are off, it's going to affect your neck. And that's where the nerves are that go out to your hands. So the first thing I do is I treat the low back. That's usually about 30 to 50% of the symptoms gone by treating the low back. Then I treat the neck, make sure I treat along the scalene muscles here because those are the muscles that tend to impinge the nerves that go out to the hand. So really the last thing I do is get out to treating the hand. So there's a whole, you got to treat the whole body. And if the person has any scars that pull on the fascia, you got to treat the scars too. Why does only my left earlobe tingle when I have both ear clips on and I'm doing vagal tone work? I would say probably your left ear is probably a little more conductive, or you just need to moisten the actual ear clip itself. If you find that it is making your ear tingle, just turn the unit down a little bit. It's fine. You don't have to have it turned up all the way. Like on a low setting is fine. You can go to medium setting. When do you change the oval? Oh, wait a minute. I skipped right over it. Let's see what we got here. When do you change the oval pad on the device? How many times can you use rectangular pad? If you're doing vagus nerve stimulation, you can leave that oval pad on there for forever. You know, there's no reason to change it on here if you're just doing vagus nerve stimulation on yourself. There's no reason to mess with that. The rectangular pads, if you're using them on individual patients, then you would want to obviously change it between patients, but you could keep the pad for future use. If you clean your skin well, you can reuse one of these pads for probably a couple of weeks. If you don't clean your skin well before you use these, you'll get 1 or 2 uses out of them. So really use this until it doesn't stick anymore and you're good if you're just using it on yourself. Unfortunately, my video is freezing. Hopefully when I get the video link, it'll be better. Lots of valuable information. Thank you. I have 2 months of flu, virus, and allergic outbreak for a week. Jeez. All right. So I need to make sure to make use of the Dolphin Neurostim. I have a witness tonight. Okay. So I would say you need to do a lot of vagus nerve stimulation. So I would use it. Normally, I recommend people do vagus nerve stimulation for general health, probably about twice a week. So I use it for about 30 minutes twice a week. You know, I raise 2 kids by myself. I work all the time. I do 10-hour days of manual therapy on patients and scar release and whatever else. So I'm tired when I get home. And when I get home, I got to cook dinner and help with homework and stuff. So I get stressed out and I get worn down. If I do vagus nerve stimulation a couple of times a week, it really keeps me going. If I have something acute, like this person who's had the flu and allergic reactions, I would start with 5 minutes. Next day, I would add 5 minutes. I'd go to about 30 minutes. And if that wasn't getting me where I need to be, I would add more time. So when you're acutely sick, you could use this several times a day. And it would definitely benefit your system. Let's see what else we've got here. A little bit farther down here. When you're using the tip On an acupressure point, do you also put an oval pad on the thumb plate along with your thumb, or no oval pad needed? When you're treating an acupressure point, just have your thumb on the oval plate. You're good to go. Can you work on pacemaker patients? As long as the doctor says it's okay, you should be good. We've treated a lot of pacemaker scars over the years, but we always get the okay of the doctor first. Let's see what else we've got here. Joe, can you go over chronic shoulder pain and stiffness protocol suggestions? Sure. All right. So if you have a chronically stiff shoulder, you probably want to make sure to treat the neck first because those are the nerves that go out to the shoulder. There are some key acupuncture points that you are going to want to treat for shoulder problems. So if you have a pen handy, I would write these down. So you're going to want to treat on your knee on the same side, a point called stomach 35. Stomach 35. So it's on the knee, same side. Knee. See? Same side knee. It is actually up against the patellar tendon. So with your knee bent at 90 degrees, you find the little hollow on the outside of the knee by the patella, and you push in on the patellar tendon. That's stomach 35. You can Google it, look it up. On the opposite foot, you're going to want to treat a point called gallbladder 41. So same side is the shoulder problem with stomach 35, opposite foot. This is a protocol I use for frozen shoulders. I actually used it today on somebody that they were considering doing shoulder surgery on. And after I got done with the patient, she had perfect range of motion and about 80% of her pain was gone. So these are useful points. So if this is, we're going to pretend like this is a foot. So this is my big toe and this is my pinky toe. So if I go between the pinky toe and I guess not your ring toe, but the fourth toe, if I go up where the metatarsals come together, where the bones come together right here, this is gallbladder 41 on the foot. So pinky toe and right up in there. So that is part of your protocol. You will also want to incorporate an acupuncture point called stomach 38, which is a royal pain in the ass to find. It is on the front of the shin on the same side. Stomach 38, same side. All these are using a negative polarity. Then after you get done with that, you want to treat, if it's on someone else, you want to take 2 Dolphin Neurostims and you want to put them both on the positive setting, so not the negative setting. Shoulders actually get deficient. We don't really know why, but they don't tend to get excessive. They tend to get deficient. Put these both on positive. You're going to go around the entire shoulder like it's a scar. So just work around the entire joint like it's a scar. And we see some nice outcomes there. Let's see what else we've got here. To help COPD. Actually, with COPD, I would, if it's an acute attack, I would use this lung point right here to help with breathing. Otherwise, I would use pericardium 6, P6. I would probably do, if it's acute on P6, I would probably use a negative setting. I would treat the entire, on COPD, I would treat the entire diaphragm because in COPD, the diaphragm tends to flatten out. So as the muscle tends to stay contracted, the diaphragm tends to flatten out. So I would treat the entire diaphragm as though it were a scar. I would go back and forth across here because you need to get some mobility into the diaphragm. What is the cost of new rectangle pads? I'm not sure what the current cost is. A lot of times they're doing sales on those, and sometimes you get 2 bags for the price of 1, or they'll throw in an extra cord or something. So you need to look on the website to see. When in constant time treatment, do we have to touch the grounding? Yes, you have to touch this when you're doing constant time treatment, unless you have this. So if you put this on here, and then stick a pad on here and stick this pad on you somewhere, then you don't have to touch the metal plate. What else have we got? How often do you need to clean the tip of the dolphin with the alcohol pad when you're using on yourself? Like daily would be great, but if you skip a few days, no big deal there. You just want to make sure there's nothing on here. There's no oil on here because it will interfere with your ability to conduct electricity. Let's see what else you guys have for me here. How often can you use this for a facelift effect? Yes, you can use this for a facelift effect. There are specific protocols for an acupuncture facelift. Could you go over again the protocol for vagus nerve stimulation if we were trying to calm down the stress before bed, relax, and promote sleep? I like using both ear clips. So I put an ear clip on either ear. I put the pad on my wrist and turn it on for me for about 30 minutes. For you, it may be 10 or 15 minutes, but it tends to work pretty well. How many times do you need to treat a scar to completely release it? So the research shows you get on average about a 20% reduction in the density of the scar per treatment, properly done. So you figure 5 treatments, you should have a scar almost completely released. Now, if you're going for aesthetics, like if you want the scar to really look better, sometimes you might do 10 treatments. When I do scar treatments, I'm treating scars because mostly they're painful and they're pulling on things and they are affecting people's ability. Scars can actually act kind of like a battery and it can ramp up your sympathetic nervous system. And anytime a scar crosses an acupuncture meridian, it's considered to be an energy blockage. So we treat scars for that as well. But 5 treatments is usually enough on a scar. Obviously, the size of the scar will dictate how long it takes because a very large burn scar takes a lot longer than like an open heart surgery scar. What else do we have here? Can you treat animals with the dolphin? Yes, you can treat animals. I have treated horses. I have treated dogs. I have treated cats. Be careful with cats. They got to be sick, really sick before you treat them. They can hurt you. Dogs and horses are a lot more tolerant. But I did have a cat that had kidney failure. I kept her alive for years using acupuncture points. The vet kept telling me my cat should be dead, and she lived for several years. So anyway, how do you get on the forum? You will get an invitation in an email tomorrow, and you just click on that, and you can sign up. How do I do that if I only have, would you treat before or after a massage? Well, you could do both, or you could treat, depending on what you're doing. If you're doing vagus nerve stimulation, you could do vagus nerve stimulation with a massage, believe it or not. So here's a question for you. Does massage reduce stress? What do you guys think? Does massage reduce stress? The answer is no, it actually doesn't. Massage actually stresses your system. Scientifically, massage stresses your system. That doesn't mean massage doesn't work. Massage does work, but it doesn't work the way you think it works. So if you're doing vagus nerve stimulation that reduces stress while you're doing the massage, you get an accentuated effect. And in terms of treating acupuncture points, I always do acupuncture point stuff first before I do massage. It just makes more sense. Why would I spend my time rubbing on muscles? Like if I can get like an 80% reduction in the contraction of a psoas muscle with 2 acupuncture points, why would I spend 30 minutes digging around in somebody's guts trying to get it released with my hands? You're working too hard. So do your acupuncture points first, then see what's left over and use your massage to address those things. It's kind of silly to do it the other way around because you end up working just way, way too hard. It's not particularly efficient, and your patients will appreciate the fact that they're getting better faster. Do you use the constant treatment mode for a scar? Yes, you could actually do that. You could put it on that constant treatment mode and just go down the scar. It's hard to hear. You can't hear the beeps, but you could count flashes of light. If I only have one clip, if you only have one ear clip, you just put it on typically the left ear. Only if you're if you find that you're really, your energy is way down, you need to bring it up. I would use the right ear on positive with the right wrist. Otherwise, I tend to stick to left ear or use both ear clips at the same time. That seems to be really good. No tips necessary. Thank you very much. I appreciate it, but I'm happy to help you guys out. How many times a day can we use vagus nerve stimulation on ourselves, and what is the max time per treatment? Well, we don't recommend more than about 30 minutes a day. That's just kind of what we recommend. However, I do know people who are healthcare providers who have had severe medical problems who have used this for hours a day. And they all seem to be live. They all seem to be better. They all seem to be kicking. It's just when you start getting into longer periods of time, it's a good idea to check with a provider first. You want to do things like, check your blood pressure and check your pulse. Like, this isn't going to kill you, but you want to make sure it doesn't bring you too far down. So here's where you're going to get yourself in trouble. Vagus nerve stimulation is used when your system is way too high to bring things down. If you take things down too low, then you got to come up. You got to come all the way back up to get to normal. So if you keep it down too low, your body has a hard time keeping up with what it needs to do to get you better. So you could theoretically overstimulate things a little bit. I don't think I've seen some cases where people had emotional, like somatic emotional releases from treatments. And I have seen one case over the years where somebody had some dizziness and some, like, they felt nauseous and stuff after a treatment, in which case we had to say, like, this probably isn't for you. But for the most part, just keep adding 5 minutes until you get the outcomes that you need. And you can certainly use it 2 or 3 times a day if you are in a really acute situation. All right. Any tips on tinnitus? Ooh, tinnitus. So tinnitus is one of those things that can be tricky. There are specific protocols for it. And I have had cases that were absolutely amazing outcomes. And I didn't think I was going to get any outcomes with these people. I mean, people who had it for years, and I did a treatment and it went away. I have also had some absolutely stunning failures on cases that I thought were going to get better. So it's a difficult thing to predict outcomes on. There are protocols for it, things you need to be wary of, or aware of, I guess. If the person has an inflammatory diet, like if they're eating a lot of sugar and wheat, they're going to have congestion, they're going to have allergies, their eustachian tubes are going to be clogged up, they're going to have tinnitus. I had a lot of tinnitus as a kid because of my allergies. And when I became an adult and I eliminated sugar and wheat from my diet, guess what went away? My allergies and all my tinnitus. So you got to look for all these external things as well. If you get trigger points in the sternocleidomastoid muscles or in the scalenes, you can actually get tinnitus from that. You have to eliminate those trigger points. You can even get homolateral deafness from trigger points in your SCM or scalene muscles. So you need to look for the other things that are contributing factors to it. But there are protocols for it. I don't have time to go over an entire protocol here, but if you will post a question in our forum, we might be able to address it for you. All right, what else have we got here? Okay, why does the dolphin have different pitches of sound during treatment? Well, let's go over that real quick. So as you pull this across the skin, keep grabbing the one that's got the dead battery. All right. As you pull this across the skin, when I get over an acupuncture point, you'll notice that the pitch goes way up. So when I push on a button, this is what it sounds like on biphasic. But if I put it on the negative setting, you can get a beeping like that. You can get a higher pitch beeping. So it's responding to the conductivity of your skin, unless it's on the biphasic setting, in which case it has kind of a loping sound. All right, what else have we got here? I don't see anything else. So do you guys have any more questions here? Got a couple minutes left. If you've got them, ask them now. All right, well, I don't see any questions coming up. So I would like to thank you guys for joining me tonight. It's always a pleasure to do these and get you guys started. Do feel free to reach out to me if you have questions. Oh, wait, we had a couple come up here. Let's see what we got here. Okay. Wrist pain, you want to treat the neck quite a bit, and you can actually you can actually take this and just stick it where it hurts, and it will reduce pain. But I would look in the guidebook that comes with the unit, and there's usually a protocol in there for arm and hand pain. What else we got in here? We've got when treating dogs, must they be completely clipped hair? No, you just need to touch somewhere. So dig your fingers through their hair to their skin, grab them up under their armpit, a place where there's bare skin, grab their ear, you're good to go. What's the protocol for headaches? Depends on the headache. If it's a migraine, don't treat this point right here. If it's a migraine headache, you want to treat gallbladder 41. That was the point we used for shoulder stuff. That's a win point. Migraine headaches are a win problem in acupuncture. And you want to treat a point called heart 9, which is on the outside, on the inside of the pinky finger right here at the base of the nail. That's a point that's typically used for acute circulatory issues like strokes and heart attacks and stuff like that. But it also works for migraines because migraines have a vascular component to them. What's a pitch we look for, and is there a sound that means it's not working? No, there is not a sound that means it isn't working. The higher the pitch, the more accurate your point location is. So two things will happen when you find an acupuncture point. The light will go out and the pitch will go up. Of the two, the pitch is the most important of them. It's very satisfying to see the light go out, but the pitch is actually the most important of the two. If you have one ear clip, do you have 10 minutes on vagus nerve stim, but do you have both ear clips for 30 minutes? Oh, if you have one ear clip, you could do 30 minutes with one ear clip or 30 minutes with two ear clips. Either way works. You could even do, say, 15 minutes on the left ear and 5 minutes on the right ear. So you could do negative on the left ear, you could do positive on the right ear for 5 minutes. I really like the two ear clips. I think it balancing things out nicely. That's a new thing that we have been doing lately, and I seem to be getting responses from that with patients. We're always trying to make this better, guys. So if you watch this tutorial in 2 weeks, we may have changed the protocol to some degree. Like, we're always doing testing and always looking for ways to get better outcomes with patients. So it's an ongoing process. If you watch this same video like in a year and it looks the same, we haven't been doing our jobs. Our job is to make sure this therapy advances and you guys get better outcomes each time. All right, guys. Well, we are at about 9 o'clock. So I'm going to wish you a very good night. Thank you for coming out. I'm going to go home and make sure my children have their homework done before they go to bed. Thank you so much, and y'all have a nice evening. Bye-bye.